So let's start with, we have 4 new companies that want to tell us in 5 minutes each what they're doing. So we're going to start with the first one already. And this is Prognosis. This is a frontline innovation. This is one of our geriatric specialists at the hospital, Dr. Alex Smith, who's going to present this to us. And go ahead and get going.
Check, check, mic check. Hello, hello. Does this work? Oh, there we go. Thank you very much, Dr. Sawyer. I appreciate the invitation. So I'm Alex Smith. I'm Associate Professor of Medicine here at UCSF, and I'm a palliative care physician. I'm in geriatrics, and I want to tell you about this website and app that we've designed called Prognosis. So what is this Prognosis? So Prognosis is a forecast, right? It's like the weather. It's a probabilistic determination of what the future might hold for somebody. And when most people think about prognosis, they think about how long somebody has to live. And that's the main thing that I'm interested in. Particularly, how old do older adults have to live? And most people think about prognosis, they think about it in the setting of something like hospice, right? Particularly when you're talking to physicians. But prognosis, it turns out, is really important for all sorts of decisions, clinical decisions that older adults have to make. Everything from cancer screening, right? Cancer screening is designed to detect slow-growing cancers, right? But the harms and the risks of cancer screening are experienced up front. So I worked with a medical student several years ago to study the literature about prognostic calculators or prognostic indices. We knew that these existed because several people in our division here at UCSF had created them, but they're kind of buried in the literature, and nobody ever used them. So we did this systematic review of them. We published it in a big journal, and I said to the first author, "This is great. Look at this, your first author publication in JAMA." And she kind of was one of these jaded, irritating medical students who said, "You know, I don't actually just want to publish something. Nobody's going to read it. I want to actually change care at the bedside and for patients in clinic." So we thought about it and we realized, you know, she's right. We need to go beyond this. So we designed this website called ePrognosis, or Estimating Prognosis for Elders, where we took all the highest quality prognostic indices, so these tools that can estimate how long older adults have to live, and we put them online in simple, easy-to-use drop-down menus with graphics, quantitative display of quantitative information, ways that are easy to interpret. And this like blew up in ways that we weren't expecting. We had like 5 articles in the New York Times. We were in USA Today. We had 500,000 page views in the first week. But more than that was physicians who came up to me and said, "You know what? I use ePrognosis." You know, surgeons who come up to me and say, "I routinely use ePrognosis with my patients because I want to know what's their prognosis aside from this surgery, right? This joint replacement that'll take years for them to benefit from. Is it worth it to have these risks?" Oncologists who say, "I use ePrognosis, right? I have a patient with slow-growing cancer. Should I be subjecting them to radiation and chemotherapy when they may not live long enough to benefit?" Right? And primary care physicians who said, "I use ePrognosis for cancer screening." So here's just a preview of what ePrognosis looks like now. We now direct people directly to the best prognostic index for the patient in front of them. We have these simple drop-down menus. You can hit Calculate Risk. You can see a display of the quantitative information, right? How many people will live, how many people will die over different time frames. And you have information that physicians were interested in about how good is this prognostic index. Does it apply to the patients in front of you? You know, one of our clinicians said, "I want something that just tells me red light, green light. Should I be screening my patients for cancer?" And now there's an app for that. Okay, this is ePrognosis, the cancer screening app, available in the iTunes store. So here again, simple, click on it. It gives you a fuel gauge kind of response, easy to understand. Should I be screening this patient for cancer? You can click on harms and see what those are, or benefits, see what those are. And you can see information that might be important in clinical decision making. Out of 1,000 women like this woman who get a mammogram, 100 will experience a harm in the first year. After 10 years, of 1,000 women like this woman who got a mammogram, 1 will avoid death from breast cancer, okay? And after 10 years, of the 1,000 people like this person, 300 will die whether or not they got tested for breast cancer. So thank you. That's a little bit of preview about ePrognosis.
Thank you very much, Alex. Also for your very succinct and perfect timing. That was amazing. The next startup is coming up right now, and this is Chris Cutter, and he's going to present to you Life Dojo. And these 3 that are presenting now, I want to reach out to Stephanie Maris, who directs the Center for Entrepreneurship here at UCSF, and she's in that center been able to give these teams great mentorship and guidance.
Hello, I'm going to talk a little bit about preventive health in a second. This is not my company, Windows. We're going to make the folks that are eating their pretzels and drinking beer a little bit guilty, but don't worry, keep going. So I came up with Windows when I was 2. And I'll wait. Is the slide beautiful? All right, we're a little bit ahead, and the clicker is here. Great. Okay, so I am Chris Cutter, the co-founder and CEO of Life Dojo, the online platform that improves employee health 1 habit change at a time. And for those that heard Bill Evans a little bit ago, my background actually is behavioral economics and behavior science. And what I had done in New York City for about 10 years was create 12-week public health programs that measurably reduced obesity rates, diagnosis of diabetes rates in high-risk populations. So think public housing, manufacturing plants, where you have 30% or more of folks that are truly high risk. And then I decided that those programs were just ridiculously expensive. We actually spent $6 million of the White House and public health money to help about 5,000 people. And that's what's happening every day. Someone needed to change that cost structure. So obesity rate in the past 20 years has more than tripled. Prediabetes, 1 in 3 Americans are now pre-diabetic. Stress, 3 in 4 Americans report their stress being higher, and it was already far above what's healthy. And the human element of all this is very tragic, and we all have family members or maybe ourselves because you know the cost. But for the American company, especially the self-insured American company, this has serious effect on the bottom line. So if somebody is completely healthy, they're $2,800 per year, but you can see how quickly it goes up per risk factor. It adds up to about $1.3 trillion each year that's wasted due to lost productivity and the cost of treating these chronic diseases. And yet, 75% of these diseases are about lifestyle. They're completely preventable. So what we have done is really taken what works on the ground, so diabetes prevention program, cognitive behavioral therapy, motivational interviewing, these all have a proven effect, and I've run half of these programs, 2/3 of these programs live. And it really comes down to this. A really good program touches on motivation. Every single person has very specific motivations. What is going to get you to actually follow through on a New Year's resolution to the point that it's a habit, like brushing your teeth? You have to find that motivation. Second, we have an environmental influence on us that is so much more powerful than most people think. So we don't really believe in this idea of like, if you just push hard enough, that's not how you change your health behavior. It has to come down to all the assessments of what's going on around you that makes you, drives you, nudges you towards what you're doing. And the third is we have physical neural networks in our brain for the bad habits we have. Think of it like a software engineer. You've had bad software engineering for the past 20, 30, 40, 50 years. How do you undo that program and replace it with something healthy? So long story short, habit change is hard. And then when you have thousands of employees like some of our customers do, right? We have a Fortune 500 that recently signed on. They have 45,000 people that they want to change their health habits, and they have 423 locations. So there's no way they could run live public health programs. So that's what we did, is we took it online. Our programs are 12 weeks long. The first week is about motivation. We use animation, humor, story to really drive people towards thinking and reprioritizing their life. Week 2 is they create a plan. So our software actually allows them to choose from among 8 habits per program. And then for the rest of those 12 weeks, they're taking action. So we actually have live behavioral specialist coaches, 15 minutes a week. And this is a little bit of what it looks like. So we use a lot of humor. Like I said, it has to be great design because ultimately people aren't going to use it. It's also on mobile. And the idea is that once you choose the habit, the software creates your own custom plan. So maybe you played soccer in high school, that's what you're going to choose. You're not going to say, oh, everyone in my employee group is doing Fitbit, so I'm going to do the walk challenge. No, you have a specific goal. The software should allow for that. And then we motivate you around that goal. So right now we have exercise, healthy eating, we have sleep coming very soon, stress, happiness, and finance, and every one of these programs is in partnership with either an Ivy League university or another research institute to make sure that the research is solid. We don't have to talk about implementation, but safe to say that just clicking go is not something we can do in an employer group. We have about 50,000 people that went through in 2014, 2015, our goal is 100,000 new habits, and it's very exciting. And that's a little bit about Life Dojo. Thank you.
Thank you, Chris. They're just doing awesome on timing here. Oh, we're presenting your Outlook calendar. So the next presenter is Patrick Randolph, and he's, I think, presenting Q Doctor. Is this yours?
Yeah, it says, yeah.
Okay. I'm good. Oh, we're good?
I think so.
Carry on.
Oh, cool. So, Q Doctor is a company I created 2 years ago to solve a problem that my mother and father had. My dad's an allergist, and he was losing 20% of his revenue in staff time to cancel appointments. And I'm naive. I thought that is something I can solve easy. I'm really smart. We solved it, but it took a while. But in all seriousness, what we're going for and what's most important to us is simple and seamless. We automatically fill canceled appointments in less than 1 minute. No work from your front office staff. We integrate seamlessly with some of the top EMRs out there. That's the first thing we've done, and we're one of the top 10 most integrated products in healthcare. Now, oh, this doesn't look good in a Windows computer. We're going to walk through a case study of one of our practices. Every single one of you has actually been through this. You have waited for doctors. The average wait is 18 days. If you're in Boston, like our CTO, you're looking at 45.4 days. Now, Bighorn Family Practice is a small practice. And they're looking at, about 14 unfilled cancellations a month. 25 hours of staff time. A lot of money and lost revenue. How can we solve this? And how can we solve this in a simple and seamless way? Well, I'm going to show you. Can we go to there we go. So this is our integration with Dr. Chrono. And this is their scheduling system. You'll see here that we have a couple patients. We got me, and we got Mark from Catalyze. We call up, and unfortunately, the earliest appointments we're getting, it's not till July 8th, and we're not excited about it. Fortunately for us, we've got Norm. Norm calls up, and he's got a Monday morning appointment. He can't make it. Calls up, and he cancels. What does the admin do? What they always do. They cancel the appointment. I can't find cancel here. Excuse me, guys. Screen's too big. Sorry, I don't know how to make things smaller in Windows. Oh, there we go. Cool. So you just cancel it. And what's happening is we wanted to get over the problem that Bill Evans was talking about. How do I get people to use this? Simple. You make it automatic. It just works. We're running in the background, and we're checking every minute for a canceled appointment. If it's more than 3 hours in the future, we fill it. We fill it with patients who are more than 5 to 10 days in the future. They want to see that doctor, that location, that amount of time, and that appointment type. Then we sort them, and we send the first 5 of them a text. The first person to text back gets the appointment. So I just got the text, and I know Mark from Catalyze did, And the first person, geez, Mark, that was really fast. So Mark already responded to the message, and I'm going to refresh the screen. And Mark just got the appointment. I know because I got the email. I can't keep up with you. And we were able to fill the appointment. There it is. That's done. We just took a process, took an hour and a half, and it's all automated. That's it. We saved them 6 to 10 hours a week. Mark, thank you. You booked the appointment. By the way, you should all use Catalyze. Can we go back to the slides? So the key here is this was simple, this was seamless. We're going to skip through some of this. That's what the text message looks like to you who are not able to look at your phones. We're filling 80% of these canceled appointments versus 40% normally. That meant for them, 12 extra patients a month, $2,000 extra, 25 hours extra. Now, that's a really big deal. They love the product. Their admins love it because they're saving time. The executives love it because they've got more money. The patients love it because Mark just skipped the wait. And we even had a patient who became a customer through them. But this is just the beginning. Simple and seamless has its advantages. We have integrated with all these EMRs, and so this is only the beginning. And the simple and seamless extends to our pricing too. If it doesn't do exactly what I say it does, we don't make any money. You can get set up in under 5 minutes, and all our future products are the same, or we don't build them. We're trying to attack complexity. And we believe that in the post-DMR world, now that everyone's got one, what's next? Well, it's products like ours that work across EMRs that are stupidly simple to use. So doctors and their staff can get back to, more important things, like treating all of you and, looking at the beautiful Jawbone data. So that's what we're about, simple and seamless. You don't even know we're there, but hopefully you love what we do. Thanks.
Nice job, Patrick. Thank you very much. And we are going to proceed on now with our last presentation in the lightning pitch round. And this is Results Care. Result Care actually originated here at UCSF as well, but has gone on and spun out of the university and was a nice collaboration between people in the university and people outside of the university. And so I'd like to present someone who's really driven Result Care to a new level, and that's Armand Jahangiri.
Thank you so much. I know this is the last one, so I'll make it quick. We're Result Care, and I'm a co-founder and the CEO of Result Care. Our motto is taking the guesswork out of medicine. And that may sound silly because you say, well, Armand, my doctor doesn't guess when I go and see him, and we all do. Every time you go to see a physician and you present with a problem, there's an amount of guesswork that goes on. We are presented with a lot of data. We're presented with a lot of papers in the literature, a lot of different variations of data. As the first presenter said, he didn't want his paper just to be buried in the literature. And doctors have to go through and be up to date to that and know about all the wearables that are coming out, all the packets of data that you bring and you say, well, my Fitbit says that my heart rate's up. What do I do? And we've created a company that uses machine learning, evidence-based medicine, and natural language processing that goes through the literature and decides what the best tests are for physicians to use when they're diagnosing a patient, based on statistics, sensitivity, specificity, and cost of care. Turnaround time. What's the point of ordering a test if it won't return in 10 days? Your patient might be dead. Is there a slide? Oh, there it is. So to do a company like this, it takes a big team to do it. And the founders are myself, an MD PhD, Mima Geer, who was a laboratory medicine physician here at UCSF, who saw this at first hand. Doctors ordered the wrong tests. Doctors ordered every test, and they wanted results. And then you need design thinking, right, Bill Evans? Mitch Geer, who's an MBA in design, really sat down. We interviewed over 100 physicians, reiterated the app, the database, really create something that was integrated easily. And you need a smart person. And Nima is our two-time mathematics Olympiad champion, gold medalist, who really does the machine learning and understands the back end. We have a group of experts that are helping us. And this is the problem, right? 450,000 new papers come out every year. How do I work up my patient? Let's say 1% of that pertains to my field, that's still a lot of papers to read. And to be able to integrate that within your practice is almost impossible. So what do most people do? They guess. They order everything. False positives happen. You come in and you say, well, I think you have this. We need to do additional tests. We need to admit you. Infection rates in the hospital. So we've created a platform that does real-time evidence, guidelines, expert opinions, cost, and pay coverage. You can have this integrated within your hospital, and you will practice better medicine. You will have access to evidence-based medicine. It's a sexy word that's been thrown around a lot, especially at institutions like UCSF. We need to practice evidence-based medicine, but how? I have 18 patients that I see in the clinic. I get 15 minutes with each of them. I have to spend 30 minutes writing notes. I don't have time to search, read, find the data, and integrate it within my practice. Design thinking, and the mathematics and the machine learning that goes along with that. So that's the company we've created. This is how it works. You search for a diagnosis or a lab, and it shows you all the evidence, the data, the turnaround time, the cost, information that physicians need right away. If you want more than that, you dig into the app and you get the information. This is the field that we're looking at. $18 billion is spent on laboratory testings alone in the year. And we're just trying to get a percentage of that and make physicians practice smarter medicine. The way we're approaching this is we've looked at the 4 largest states with the most physicians in them, and we have ambassadors that are integrating the Result Care app within those locations. And that covers, the frozen, about 44% of the physician population. What we're trying to do is create something that everyone can use. You may never hear of Result Care again, but we want our platform to be open to everyone else that wants to access it, who gets this information and integrates it within their app. We're not just another app, but we're a digital health platform that uses evidence-based medicine, design thinking, and makes our physicians practice smarter medicine. Thank you.